Hello, my name is Kristen. I'm a nurse practitioner student. I'm going to do a head-to-toe assessment today, if that's okay with you. And what's your name?
JT.
Good to meet you, JT. So this assessment, I'll need you to take off your shirt, if you don't mind. Thank you. Looking at skin, his skin is pale, appropriate for the season. He has good color, good skin hydration. Everything is symmetrical. No lesions noted, no nevi, no other abnormalities. Do you have any other skin conditions? Hygiene is good. He is clean and well groomed. Looking at your hands, if you don't mind. His nails are cut short, well groomed, good hygiene. They show no ridges, no other abnormalities, no spots, no ridging. Cap refill is great. Hands are symmetrical. Can you put your nail base? Good nail base angle for him. Looking at his hair, it is thick and well distributed. No abnormalities noted on the scalp. Do you feel any tenderness when I touch through?
Nope.
Good. Looking at his head, it is normocephalic. Everything is symmetrical. Contour is smooth. And then I'm going to touch your sinuses, okay? So let me know if you have any tenderness. Maybe that hurt.
Nope.
You don't note any swelling or any difference in temperature. Can you puff out your cheeks? Like, good. That is cranial nerve 7, the facial cranial nerve. Looking at your eyes, they are symmetrical on your face. Because I can't really see in here because it's dark, I'm going to check your skin length of color. They are blue, irises are good, sclera is white, conjunctiva is pink. I'm going to shine a bright light and check your direct and consensual constriction of your pupils. Okay, I'm going to do that one more time. And then I want you to follow this in. Good. So he has good direct and consensual constriction, accommodation. Pupils are 3s and briskly reactive. I'm going to get my, what was I using for that? My handy dandy ophthalmoscope, and I'm going to look to see, I'm going to catch your red reflex. I'm not going to get too close because I don't want to actually poke you in the eye. So I'll find your red reflex and follow it in. Great. And now I can see your optic disc. No cupping, edges are smooth, no hemorrhaged retinal vessels. General background is clear, and I can visualize the macula. And then I do that on the other side. I would find your red reflex, follow it in, find your optic disc, no cupping, it's smooth, retinal vessels are intact, no hemorrhaging, general background is good, and I see your macula. Okay, so looking at, your ears. They are symmetrical on your face. Skin color is good. Your pin eye is in line with your outer canthus of your eye. So I will go back, look in. Helps if the light is on. See some honey-colored cerumen. Can visualize the tympanic membrane and the cone of light at 7 o'clock. I don't know any other irregularities or any scarring. I will pull back. Again, note honey-colored cerumen and the tympanic membrane is visualized. Cone of light at 5 o'clock. No other irregularities noted. Looking at your nose, it is symmetrical on your face. It's the same color as the rest of your face. I'm going to look up in it if you don't mind. No internal turbinates noted. It is pink and dry, and the septum is midline. Now I'm going to look at your mouth and throat. Lips are dry and pink. Make you paranoid. But they are symmetrical on his face. If you can open up so I can look in. Buccal mucosa is moist and pink and intact. I note a bifid uvula. I can see the pharyngeal walls, posterior and anterior walls. I can't really visualize the tonsils. Teeth are straight, none missing, no broken, no chipped. I'd give him a Malampati of 1 because I can see right down that throat. Could you bite your overlip? Good, so he passes the upper lip bite test. Thyromental distances. Yeah, I'd give him 3 finger breaths. Probably a fairly easy intubation with him. Looking at his neck. Part of your ears is your hearing. So, to check your cranial nerve 8 acoustic, we will do the whisper test. So I'm gonna have you cover that ear, and then when I repeat whatever word I whisper, okay?
Baseball.
Good. We'll do the other side.
Apple.
Good. Now I'm gonna hit this and put it on top of your head, and I want you to tell me where you hear it, okay? Did you notice it on one side or
I noticed it a bit on both, a bit stronger this side.
Good. So the Weber test is no lateralization noted. Okay, now on this one, I want you to tell me when you quit hearing that.
Could you strike it again?
Yes.
I don't hear it anymore.
Yeah.
Yes, I hear it.
Okay. We'll do the other side.
I don't hear it anymore. I don't hear it. I think it might have faded out.
Try again.
Okay, I don't hear it anymore. I still hear it there.
Okay, so air conduction is greater than bone conduction, which we would expect. Real quick, while I've got this, I'm going to see if you feel this on these joints. Okay? You feel that?
Yep.
Oops, I turned it off.
Yep, I feel it. Feel it. Feel it.
Okay, good. You have sensation there. sensation anyway. All right, looking at your neck, it is symmetrical, the same color as the rest of your skin. Trachea is midline. I'm going to check your lymph nodes, so pre-auricular, posterior auricular, occipital, submental, submaxillary, submandibular, tonsillar. We'll check the posterior cervical, deep cervical, supraclavicular, infraclavicular. Noting if I were to find any lymph nodes, consistency, movement, temperature, and any other abnormalities associated with those. Okay. We will move on to your lungs. So for this, I'm going to have you turn just so that they can visualize what we are doing. And I just see my candle. I'm supposed to check your sense of smell, cranial nerve 1. All right. So visualizing the posterior back in our weird little clinic. Everything is symmetrical, posture is good, skin color matches the rest of his body. I'm going to palpate. Do you have any pain with any of that as I do that?
Nope.
Okay. And we'll move on to percussion. I like exam tables better. Okay, so I put dullness here. If you would, take a deep breath in and hold it for me. Good. Here. If you can breathe. Sorry, but okay, and then take another deep breath in. Okay, good. So looking at that, diaphragmatic excursion is appropriate. The right is about 3 centimeters lower than the left, which is to be expected. While we're here, I'm going to have you take another deep breath in and breathe out. And that was symmetrical chest expansion. Okay, I'm going to take a listen to you, so just breathe in and out, okay? You can lift your arms for me and just breathe. Okay. You can face back to the front again. Oh, sorry. And my foot fell asleep. Okay, so here we go. Back to the front. So I'm going to look, skin color the same as it has been. Everything looks symmetrical. I'm going to palpate. Tell me if you have any pain.
None.
I forgot something. We'll finish this. Okay. And then signature. Okay, I'm gonna focus. Kind of hard to get down into the tissue and it's still here, so I'm gonna listen to you. Just breathe. Listening through all the lung lobes, front and back. There is no rhonchi, rales, stridor, wheezing. They're perfectly clear all the way throughout. You'll turn back to the side again. I forgot the one weird thing. Okay. So say 99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99.
99.
Good. Tactile dermatitis noted throughout. All right. Turn back again. Uh-oh.
Come on, babe. Come on. Yeah. Go on, go.
We had an intruder. Excuse us. Now I'm going to listen to your heart sounds.
Okay.
So I'll start with the aortic. Pulmonic. Verbs point. Tricuspid. Mitral. Feel your apical pulse. No thrills, pulsations noted. I hear S1, S2 very clearly. No clicks, no murmurs, no irregularities noted throughout. I'm going to check your carotid pulse, but first I'm going to listen for bruits. No bruits noted, so now I can palpate your carotid pulse. Fun fact, don't do them both at the same time, because you cut off the blood flow to your Good to know, huh? Carotids are strong. We'll check other pulses. Brachial. +1 on lip. +1. Good, +2. Good, +2 on the radial. On the popliteal. Good, +2. +2. And then dorsalis pedis. +2. And +2. And posterior tibial. +1. +1. Looking at your vasculature on your lower legs. Color is the same as the rest of your skin. No edema noted. no vascular issues noted. Okay. I'm gonna have you lay back for your abdominal exam. Okay. Looking at your abdomen, it is, you put your arms by your sides. Your abdomen is flat, a little rounded, but flat. Skin color is appropriate for the rest of your body. There's no peristalsis noted, no, I don't see any vasculature apparent. Are you super ticklish?
Not really.
Not really? Okay. First I'm just gonna listen to you, okay? Bowel sounds noted equally throughout. Active, probably getting close to dinner time. Okay. I'm gonna percuss, so I'm gonna tap on your belly. Do you have any pain I need to know about? Okay, it's almost there. Almost there. And then it's almost down there for the bladder. Now I'm gonna palpate lightly. You just let me know if you have any pain. Okay. Do you note any pain? So I'm gonna palpate a little bit deeper, and then looking for your liver and spleen. So I'm gonna ask you to hold, breathe in, and then let it out. Okay, and we'll see if we can feel anything. Okay. Take a deep breath in. Breathe in. Release. Patient has very good abdominal muscles, so that I'm unable to palpate the edge of the liver. I'll try again. Keep going. Okay, take a deep breath in. Breathe out. We cannot palpate the liver. I'm going to push in here. Do you feel any pain when I let go? I don't think I'm going to get to your aorta. No, there will be no aorta finding on you. Let's see. Do you have any pain when I lift up?
No.
Okay. We're going to check for ascites that you don't have. Nope, not yet.
Thanks, I turned to the side.
Not yet. Okay, turn it this way again. Don't note any ascites. While I've got you down like this, I'll check your inguinal hernia and nodes, and check your femoral pulse, which is +2. I don't note any hernias or nodes. Okay, you can sit back up. All right, so we're gonna start musculoskeletal section. Looking at your joints. Do you have any pain in any of your joints? Okay, so just from a glance, muscle tone is good. No abnormalities noted in contour. Everything looks symmetrical. I don't note any redness or swelling or, you know, any warmth on anything. And check your TMJ, so I think I forgot to include. So open your mouth and close it. Any pain with that? Okay. And then I'm gonna feel of your shoulder, and we will go through all the range of motion. So how do you lift it up? Do you have any pain with that?
Nope.
Good. And then we'll go across. I don't feel any crepitus or anything here. And then internal, external. Okay, let me do your other one to compare. So, I don't note any abnormalities. We'll lift your arm up. Good. And down. And in and out. Go across your body. I did feel a pop, but I don't really note any crepitus or anything. Going to your elbow, olecranon process, the ulna. Don't feel any problems here. We'll straighten it out. There, and then out, and in. Do you have any problems with that?
No.
Okay. This elbow. No problems. Twisting all sorts of ways.
It's just funny how Bandit just stands there.
Yeah, wow. That's what happens when you have pets in your office. We'll look at your wrists and hands, feeling all the joints. I don't note any swelling or deformities. Give me a good squeeze. Good. And then I want you to put your arms up and resist. Yep. Good, you're so strong. You have 5 fingers on each hand. You want to move your wrists and good. You have any pain with that?
No.
Okay, we'll do the phalanx. So if you'll take your hands right here, and we'll keep them there for a minute. And let me know if you have any numbness or tingling in your fingers. Do you note any numbness or tingling? No. Okay, let me have them. And then this will be tendons. So let me know if you have any numbness or tingling. We're recreating carpal tunnel. Do you notice anything?
No.
Okay. I think you can feel my carpal tunnel.
I don't even know what carpal tunnel is.
Remove your fingers, adduction, all that. I don't notice any problems with those. Okay. We'll have to have you lay back down for the knees.
Okay.
So knees are all good. Don't notice any abnormalities. Do you have any pain in your knees? No. I'm going to do McMurray. I'm going to sit on your foot. I'm going to pull, push. I don't notice anything there. And then we'll do the drawer sign, which you should be laying more flat, but we'll make it go. It'll be fine.
Yeah,
Bring it up.
I need to.
Do this, and then straight. You're notice just a click, but I don't notice any crepitus and no pain for you. Okay, I'll do the bulge sign. And we try to milk what fluid is not there and test for it. And then we'll do balloon. You have zero fluid at all, none at all. We'll do it on the other side. Just any pain, I don't feel any destabilization at all. Okay, so I'm gonna push your foot in. Nope, nothing on that. Again, we'll check the hold, check the sides. So you have no fluid to even play with at all. No, nothing. Tell us in the right spot. I guess while you're here, I'll do ankles. You want to flex and point. Do you have any problems? Can you turn them in and out? And check your toes. Your feet are cold. Okay, let me sit back up. And clean my hands. Touching your feet. I'm gonna have you, I guess, stand up for spine. If you can get around the dog. Here, stand here. Oh, I don't. I'm gonna palpate. Do you have any tenderness? No. Any tenderness? No, at all. Your spine appears midline. I'm gonna have you bend over and try to touch your toes. Spine is straight, able to bend, stand up, and then try to lean back. Good. Bend side to side. Good. Now face knee. And do you have any problems in your hips?
No.
Okay. Do you want to take them through some range of motion and out? Good. Look at your balance. Go back. Okay, other side. This is why I don't have an office in the house. Oh, you did that on purpose that time. Okay, so sit back down. Neurologically, you appear to be appropriate. Your appearance fits in with doing a faked assessment in your home. You're hygienic. Your movement, you have proper posture when you try, and good balance. I didn't check your gait. Would you mind to stand up and just walk? Tiptoes, yep. And then come back on your heels. Good, you're able to walk. Have good posture. You can sit back down. Mood is appropriate for the situation. You seem like you're in a decent mood. We would talk more and evaluate whether you have depression or anxiety. Looking at your thought process, you've been able to follow all of my instructions clearly. Cognition, you are able to follow all commands, answer questions appropriately, and your speech is clear, and your responses are appropriate. We will do some more neurological things. So I'm gonna have you close your eyes and then tell me where you feel this.
Right there.
Good. And this.
Right there.
And this.
Right here.
And here.
There.
And boop. And there. We also need to do your vision test. So I want you to read. Also, my vision is not good. So you read this bottom line down here and hold it about right there.
And cover an eye or something.
Cover one eye.
4, 2, 6, 7, 3, 9.
Good. And then do the other one.
4, 2, 6, 7, 3, 9.
Good. And then if you'll cover one eye, I'm going to cover mine and tell me when you see my finger.
See it. See it. See it.
Your peripheral vision is better than mine. Okay.
See it.
Really?
See it. Yeah.
Oh, goodness.
See it.
Oh, wow. Okay. I need to go see somebody, apparently. Peripheral vision is good. Temperature, you feel like normal temperature and in the air. You notice when things are cold or hot. Okay. Let me think where I'm at. I got distracted. I'm going to check your deep tendon reflexes. So I'll start with your biceps tendon. Ooh, I got that one. And we'll do the other side. I don't know if you can see. Oh, there you go. You got it. Okay, and then triceps. Didn't expect me to get it, did you?
No. I just hit the bone.
Oh, sorry.
No, you're fine.
Stop. I think you're being dramatic.
I am dramatic and you know that.
Brachio. Malleus. And then I'll do your knees. If I were mean, I would scrape your belly and do that one, but I won't. Try to skip back and let's rest your knees, because I think we were talking about that though. It's harder to do if your feet were. Okay. And then I'm going to do Achilles. Good deep tendon reflexes. So, now I'll have you put your hands down. I want you to move them really fast. Good job. And then I want you to touch your nose with finger. And then touch my finger. Touch your nose, touch my finger. Touch your nose, touch my finger. Touch your nose, touch my finger. Good. And I don't notice any involuntary movements like, and you did those appropriately, so cerebellar is intact. And Let me think through it all before I submit. Mm.
That cat's a stalker.
I did all the cranial nerves throughout the exam. We tested smell, your vision, 3, 4, and 6 with the, oh, did I do that?
Yeah, it wasn't through.
The H?
Yeah, you did
Okay.
that.
It's all running together now, what I haven't done between our practices. So I checked 3, 4, and 6 through that. I had you clench your jaw for 5.
Remember, you can review the video footage as well.
Oh yeah. Then you have to start over.
Well, I mean, yeah, but
And then, so 5, 6, 7, we did your facial muscles. 8, we did with hearing. 9, I didn't check your gag reflex, but your uvula moves appropriately, and I will assume it is intact. 10 and 12, ooh, your tongue, did you stick it out?
I don't think I did.
Stick your tongue out, move it right and left. Okay, so 10 and 12 are good. Shrug your shoulders and head movement, I think we did all that, and that would be 11. So that hits all the cranial nerves for sure. Okay, do you have any questions for me?
Nope.
We'll call it done.
Okay,
Thank you.
Thank you.